Aside from the wintry and frigid weather, there was also worries about the spread of many illnesses and viruses. Western Mass News spoke with Bay State Medical Center and has more. Matt Price. This has been quite the season when it comes to viruses.
It definitely has been, Chris. We are currently dealing with what's being called a quaddemic, as 4 viruses have been spreading this winter, at least 3 of them recently being noted as a good number of times by Springfield's Bay State Medical Center.
This has been worse historically compared to the last few years.
It has been a wild season health-wise this winter, and it has not been easy for the public. Right now, we are in the midst of a quaddemic, as 4 viruses are going around and causing many to either have symptoms or get really sick. Those viruses being influenza, both A and B, COVID-19, RSV, and norovirus. According to Bay State Medical Center's chief of the Division of Infectious Diseases, Dr. Armando Paez, they have noticed a spike in cases last week alone, forcing the hospital to send out an advisory.
We test patients for all admissions with respiratory illness coming into the Bay State. For example, for the past week, there were like 40 positive cases for flu as opposed to about 15 of COVID cases.
According to the Massachusetts Department of Public Health flu dashboard, last week witnessed a 0.66% increase in influenza-like illness visits compared to the prior week. And from February 2nd to February 8th, the Commonwealth saw over 10,600 total positive results, including a little more than 9,400 for flu type A. Dr. Paez explains why we may be seeing more flu cases now.
If we didn't really have any flu in the last few years because COVID-19 had been really circulating, the population immunity probably slower compared before, and thus it's actually causing a lot more infections and flu cases than COVID-19.
Dr. Paez says those who have pre-existing medical conditions when hit with any of these viruses are the ones likely to spend time in the hospital. Symptoms everyone should keep their eyes out for any of the 4 illnesses include congestion, cough, fatigue, fever or chills, headache, sore throat, and nausea or vomiting. With about a month left to go in winter, Dr. Paez says it's vital for those who haven't already to get their shots.
Anyone 6 months and older should get the flu vaccine. It's not too late to get that. It will probably help in preventing hospitalization and can prevent death, particularly for those who are at risk of severe infection.
Now, those of you who show any symptoms should contact your medical provider, who will give you the proper guidance on how to move forward, which could include taking an at-home test. Dr. Paez also says the hospital has telehealth services for any questions you may have. Reporting live in the studio, Matt Price, Western Mass News.